Hello, my name is Neil Desai, and I will be going over dyslipidemia topic of the cardiovascular section in this NAPLEX review course. As you can see, these are some of the topics covered on the NAPLEX in terms of cardiovascular disease. Note that some of the medications overlap between different um, types of cardiovascular diseases, so it's important to recognize the differences in how the medications are used between these different disease types. So lipids are a very important thing in our body. They are used for helping with energy, helping with the structural role of our cell membrane integrity, hormone synthesis, used as a precursor for steroid hormones. Bile acid synthesis, fat digestion, vitamin transport, specifically the fat soluble vitamins like A, D, E, and K, insulation protection to protect the organs and keeping and conserving heat as well inside the body. Um, so dyslipidemia is where the lipid levels are very high and lead to abnormal lipid levels in the blood. So this leads to high LDL levels, which is bad cholesterol, triglyceride levels increase, and also decrease in the HDL cholesterol, which is good cholesterol. So it is important to check the monitoring parameters to make sure the patient's cholesterol is also at normal levels, and to see where they are, because cholesterol, when it's very high, when there's abnormal lipid levels in the blood, this may lead to risk of atherosclerosis, coronary artery disease, stroke, peripheral artery disease. As a result, might even lead to heart attack, heart failure, all those kinds of things. So it's very important to maintain cholesterol at normal levels. Specifically, we want to see more HDL and less LDL. So we want to keep LDL low and HDL high in this case. That's the goal. And so these are some of the lipid laboratory goals you should be familiar of when you're taking the exam. Note that, total cholesterol should be less than 200, LDL should be less than 100, HDL should be greater than or equal to 60, and triglycerides should be less than 150. Note also sometimes the HDL varies between the gender as well, male and female. So you should know between like the 40 and 50 range for like the genders as well. So this is important as well. So that was just a quick brief overview of the high lipid levels that lead to dyslipidemia and how it can impact other body organs and heart and all other parts of the body. So in this case, we are just doing a preview, so I'm just going over some of the mechanisms so you at least have a picture or an idea of how these medications work. So when you go and take the exam, at least you have an idea where these medications are working in our body. Just to make it easy for you all, most of these medications are working around the liver. So you're going to see here statins. Statins work in the liver. They actually block the enzyme HMG-CoA reductase, which is used to convert HMG-CoA to mevalonate and mevalonate to cholesterol. So by blocking it, we will lower the LDL receptor in the plasma. And so Well, LDL receptors are important. We want to make sure we have those receptors to collect all that LDL so we can get rid of it from our body. Um, there's going to be a mechanism in here where LDL receptors get destroyed and then less LDL receptors are available to pull that LDL from the blood and get it out of the system. So one of the medications you're about to see is a PCSK inhibitor. PCSK, you're going to see it in the later sections, but this is a very important fundamental part of how it plays a role in increasing or decreasing the effect of the LDL. So you'll see how that works. Ezetimibe is another medication that's used in our gut. You can see here it is blocking one of the enzymes or the transporters. That's the NPC1L1 that actually takes the cholesterol out from the intestine and then reabsorbs it back into the liver. So that by blocking it, the transporter responsible for this to absorption is going to decrease. So you're not going to see, you can see how it's kind of blocking the transporter here so that this cholesterol, dietary cholesterol, and the fatty acids, all that doesn't get reabsorbed back into the liver. So it's just going to come right out through this intestine. So the overall, the result of blockade is that it's going to decrease the cholesterol absorption from the gut. It's going to decrease the delivery of cholesterol to the liver. And then the LDL expression receptors are going to be pulled out of the liver to compensate. So you're going to see more of the LDL receptors going up at top of the liver to compensate for the loss here. So this by overall, it's going to decrease the LDL cholesterol levels in the plasma. So that's what's going to happen here. I want you to just take a look here, and you can see how at the end here, how the LDL is receptors are being pulled right from the liver. And you can see here how this dietary cholesterol is going straight through, straight back to the liver. So this transporter is just blocked so it can prevent that from occurring. So I just want you to get an idea of how this is working in the process. Here's another one too right here where the transporter is blocked so that this cholesterol is not getting reabsorbed. So like you can see it's not going back up like this arrow here. So just giving you an idea. So that's pretty much it here. It's just to prevent that cholesterol from being reabsorbed back into the liver. Then here, this is what I was talking about, PCSK9 inhibitors. This is where the PCSK9 is essentially pro-protein convertase subtilisin Kexin type 9 protein. And it's in a protein that's actually produced by the liver that binds to LDL receptors. when the PCSK9 binds to the LDL receptor, it is targeted for degradation, destroyed, and recycled. Normally, these receptors, when they're made in the liver, they get recycled or destroyed. But in this case, this protein is destroying the receptor responsible for taking in all these LDL particles. So what happens? The LDL particles are going to remain in the blood and lead to plaques and block the flow of the blood throughout the body. So that's why that's where this PCSK9 inhibitor comes in. When it's injected into a body, it's going to block this protein from binding to that receptor and destroying that receptor. So that's essentially how this is working. Now, this medication is not really used as a first-line therapy, but it is used in cases where a patient is unable to tolerate a statin and statin cannot be used. So they might consider this an option. This is one of the high cost medications, so it's not likely to be used to help decrease cholesterol, but it does help with lowering LDL levels in the blood. Um, so that's essentially how this works. This one is a diagram talking about bile acid sequestrants. Bile acid, liver normally converts cholesterol to bile acids, which is secreted into the intestine to help digest the fats. So you can see here, I drew a picture of the bile acid and then the cholestyramine as one of the bile acid sequestrants. There's also cholesterol and cholestid, but commonly in pharmacies you might see cholestyramine being used. So cholestyramine is one of the bile acid sequestrants, and it's a positively charged resin. So whenever that's in the gut, it's going to bind to the negatively charged bile acid. So that bile acid does not get reabsorbed back into the liver. It actually gets excreted through the gut. So um, that's a basic picture of how this works. So you guys can see that. And then the liver will sense the decreased bile acid return and then convert more cholesterol to bile acid, and then that's how it will just continue to excrete more of those LDL so that LDL levels can decrease this way. So that's just one of the other mechanisms here, how they work. Another one is the fibrase mechanism. This is where the fibrate binds to a PPAR alpha, which is peroxisome proliferator activated receptor alpha. It's another receptor, it's a nuclear receptor in the liver. And what happens? So whenever the fibrate binds to it, it's going to increase the lipoprotein lipase and enhance that is normally used to enhance the breakdown of the triglyceride. So it's going to increase that and break down the triglyceride levels, and then also decrease the production of the VLDL. Also, the triglyceride is going to be used more for energy, not for the fat, and increase the synthesis of apolipoprotein A1 and A2, which is essentially going to increase the HDL levels as well. So that's what it's going to do. This isn't very commonly used medication, so it's just there for reference. Fibrates are like, one of those they're not very first line medications, but they do help in a way, at least helping with the HDL levels to increase. So just wanted you to take a look at this. Um, so technically, it's just preventing this triglyceride from turning into fat and being used more for energy, and then increasing more of the HDL levels. So, and also decreasing the VLDL, which all of this triglyceride, this VLDL specifically is not a good cholesterol. So you wouldn't want to increase in that anyways. But HDL levels, that increasing is good. So this would actually help in a way with the HDL levels. Omega-3 fatty acids. One of the medications that you might see in a pharmacy is Vascepa. And how does it work? Essentially, it's going to inhibit omega-3s, inhibit hepatic triglyceride synthesis by reducing the diacetyl acetyltransferase DGAT. So you can see here in this diagram how DGAT is used to convert that fatty acids to the triglycerides, and then to VLDL, and then LPL is being used. So you can see how it's kind of turning it into the bad cholesterol. So you're going to use this medication to block this enzyme used in this conversion, in this case the DGAT, and also decrease the production of VLDL particles as well overall. So just note that this is, you may see a slight increase in, you might see an increase in HDL when you're taking this medication. Some of the other medications other than Vascepa are known to increase the LDL slightly. So just note that Vascepa does not do that. So it's a good medication. It will help prevent this from converting to bad cholesterol. It will not increase the LDL slightly either. So just note those things here. That's pretty much it on this mechanism. The niacin mechanism, niacin is vitamin B3, and niacin inhibits the similar types of transporter, the DGAT2, which is essentially used for the conversion of triglycerides to the liver fat. So when you block the DGAT2, you're going to block that production of the liver fats and the triglycerides. So it's going to decrease it. So that is what this medication does in the liver. And overall, it will decrease the LDL formation as well, because the LDL comes from the VLDL. So essentially, you might see increase in HDL as well. And that's pretty much it in this diagram. I'm not expecting you to know all of these other things here, the SREBP and all that other stuff. That's not important. Just know the relevance of some of these medications, how they kind of block the enzymes in the liver. As you saw how DGAT was blocked by the omega-3 fatty acids, and how this niacin blocks DGAT2 transport, and knowing those differences as well, and the end result in this case as well. So it's kind of important to know this as well. The other stuff is not really relevant for the testing purpose, but at least knowing how this conversion is blocked so that you guys have an idea here.